behalf of WHHI-TV, continuing our conversation about the VIMS programs and healthcare clinics that we have in the Lowcountry, I have Cassi Kirkpatrick, we have Pam Toney, and we have Dr. John Newman here. And we can continue our conversation about the VIMS program. We're also going to talk about the Good Neighbors Free Clinic. These all provide a huge service to our community. And before we go too much further, I really want to talk about the VIM, the Volunteer Medicine Program. It's the acronym is VIM. Oftentimes people hear that, but not sure what it means. So Dr. Newman, I want to talk to you about the history of the program, because it's actually a nationally renowned footprint, right?
I think that the Lowcountry should be incredibly proud that the Volunteers of Medicine started right here on Hilton Head Island with the vision of one person, I would say Dr. Jack McConnell, that he was an amazing person that really rallied, not only recognized the need, but also recognized the solution. And the solution was the folks that had retired here on the island that were sitting there. And so when we talk about recognizing those that are hidden and invisible, he wasn't just talking about the patients, he was talking about the solution as well. But he brought them together, and for the past 30 years.
That's right.
He has been able to create a process that the model is built around taking the volunteers and taking the patients and put them in the clinic, and it has worked. And so the very first Volunteers of Medicine happened to be right there on Hilton Head Island, but it has now been spread about 120 times across the country. And really asking the one question that was asked to him as a child, you know, when they're sitting around the dinner table, is what have you done today to help somebody? And so that's been the fundamental principality of Volunteers in Medicine. And you talk about how great it is for the patients, but I would say it's equally great for the volunteers.
Yes.
And so I would say that all these organizations, you know, deliver excellent health care, but to have purpose and be surrounded by love and to give patients hope, that's a fun place to work.
Well, you know, you guys are innately caregivers. You're practitioners. You know, you've all been practicing for many years. I don't want to say decades, of course, but it's in your soul. You know, it's in your soul and it's in your blood. And after you sort of have that retirement, you sort of let the layers of all of what happened in life. You decide, well, you know, I'm missing my passion, and how can I be part of that? How can I help? And it's really about helping, correct?
Yeah.
Well, and I think it's interesting also to notice that the free clinics now as a whole throughout the country are using the Volunteers in Medicine model to start their free clinics. And so we are all of us part of an organization called the National Association of Free and Charitable Clinics. And so they have taken that on as their mission, that free clinics that are now starting up will all have the Volunteers in Medicine model. So that's not to say that one's better than the other, but it's a model that everybody now is recognizing is so important.
Right, and something we should talk about to keep the lights on in these clinics. We talk about funding. We have a lot of charity events that happen all the time. There's also grants that are written constantly, correct?
Yes.
So tell us a little bit about the challenges of that, and can you start with you? Tell me.
Well, first of all, I want to just say I think all of us are under the National Association of Free and Charitable Clinics, as Pam mentioned, and also the South Carolina Free Clinic Association. They're huge supporters of our clinics and our accreditation and make sure we're all following certain guidelines. But also, as far as the donors go, you know, we have big grants, but we also have individual donors. We have people that give every month $20. And, you know, that's what they can do and they want to be a part. So when we talk about donors, it's so often that people only think about the big donors and the big grantors, but really everyone can help. Even if you're not clinical, if you don't want to volunteer, there's an opportunity to help. And so I want to make sure we highlight that. But is it a challenge? It's always a challenge. How do you budget when you don't know what's coming in the door? That's a difficult thing, but that's the world of nonprofit. Well, you put a lot of hope and faith into the public, to the community. You know, we look at the people in our operation that spends their time volunteering, and we know that they mean a lot. So I personally, I don't know what these guys do, but I challenge my volunteers to go tell our story, because the key is about the story. It's about human beings and nature, and we all, for the most part, want to do well and we want to help others. And so a lot of people just not sure how to do it, and hey, I can do that by $5. Everything for us, for every dollar donated, gave us $8.28 worth of return on investment. You know, I'll take that.
That's really good.
Yes.
Can you say that one more time?
Our personal return on investment for 2021 was, for every dollar donated, we generated $8.28 worth of medical care. That's pretty impressive.
And that's truly the retail value of what you do. But if you look at the quality of years that you've added to people's lives, that are contributing to your community, to your families, to the economic force, that number is astronomical. It's
Right.
up around $200. So
Yeah.
you're just taking credit for the actual work you're doing. But if you really look at keeping people out of the emergency rooms and extending people's lives, I mean,
Yeah. Good point.
Yeah,
That's a very
it's
good point.
awesome.
And keeping people out of the emergency rooms and taking that drain there, right?
That's a big issue, because so many people will go to the emergency room if they don't have a primary care physician, which is hard on the patient, because then they are still billed for the services. It's not free, and so then that might affect their credit score if they can't pay, and then it puts a drain on the hospital as well. But one other donor I wanted to mention also are our patients. Our patients are always giving donations. It may be 25 cents, and every once in a while we get a $20 bill. So our community, I like to say that we're a community-free clinic, really supported truly by the community. Everyone in our areas, in our 3 areas, really support us, as do our patients.
Wow, this is very heartfelt. So as we close our show, I really want to share with the community to support the clinics. I mean, it's a wonderful feeling to know that we're watching out for our community, because they really help. The people that are coming here are working in our community, and they need a little support back, correct?
That's right.
Absolutely.
That's right.
Right. Well, I want to thank you very much for joining us.
Awesome.
I want to thank Pam for inviting us.
Yeah.
This is Pam's show,
This
and I want
is
to
great.
thank her. We work so well together. She's been a great mentor.
Great idea, Pam. I'm so glad we brought everybody together.
Well, I'm glad that everybody's here. It's good to be at the table.
Well, thank you for joining me and us together at 843 TV, where communities come to speak.